We were in our rooms for 6 months. That's a long time.
Nancy Foote lives at Summerfield Estates Independent Living in Tigard. More than 100 people living here have been taking precautions and are COVID-free.
We've never had one yet, and that's pretty awesome.
But Executive Director Kevin Stottleman says
Pretty tough.
safety comes at a cost.
It also affects how they feel. I mean, where else do they go besides coming to breakfast, lunch, and dinner?
We can't see our families, and we can't get out with our friends.
A vaccine could change that.
They can have family members back in. That's the toughest part.
Summerfield is one of the first senior living communities in the country signed up for the CDC COVID-19 vaccine program. Once a vaccine is approved, Walgreens and CVS will help vaccinate seniors for free.
Get someone to come here to be able to give the vaccine.
So we thought about what would be the best way to distribute vaccine.
Dr. Jan Medlock is an associate professor at Oregon State University focused on biomedical science. His research in 2009 about the flu and H1N1 highlighted who should get vaccinated first, depending on personal risk, vaccine supply, and viral spread.
And I think that's really interesting to think about in terms of COVID-19, because obviously the dynamic is different than H1N1, but will make a big difference in how we have that conversation of priority.
That's right. We saw that it was better to actually vaccinate the people who do all the transmitting.
During H1N1, vaccines were less effective, so vulnerable communities were made the focus to reduce risk. But with potential COVID-19 vaccines from Pfizer and Moderna being about 95% effective, Medlock says younger people who are now spreading the virus need it too.
Indirectly protect the people who are actually at risk of severe disease and death.
He says medical workers and first responders also need priority.
We all need to be vaccinated.
Cara Johnson also lives at Summerfield, and while we all wait for the vaccine, she says people need to think of vulnerable communities like hers.
Wear your masks, for God's sake, not just to protect yourself, but to protect other people.
What is your hope for the future as a vaccine gets closer?
I will certainly line up and take it. My concern is that there are still a plethora of people who think it's all a hoax. And they're on their deathbed and they're still saying it's a hoax.
Cara and Nancy waiting to be some of the first in line for a COVID vaccine.
It's going to make a big difference.
I'm Galen Etlin for KGW News.